Yes, so hello, good morning, good afternoon, good evening. We are live now, Mommy. We'll wait for a while for one or two people to join in before we start. So enjoy the music whilst we wait. Thank you. Hi, good morning. Someone has joined in. So let's start. Thank you very much for giving me this opportunity, Mami, Oduraa, Nuamah, for joining me this morning to have this conversation on cervical cancer. January is cervical cancer month, and for me, it is not just January, but this is the awareness month. It is something that every woman should, when you are of a certain age, you should make it a habit of having a screen, for cervical cancer. Not even just that, breast cancer and some other cancers. So this morning, I am with Mami Akua Oduraa Nuamah. I love her name because Oduraa, my grandmother is, my grand auntie rather, she's Oduraa, so I respect her a lot. She wouldn't know. All right, so Mami, good morning.
Good morning.
Mami, can you hear me? All right, great. So
yes,
you
I
are
can
going
hear
to
you. Good morning.
great. So say hello to your listeners, and then you can share on your page on
Hello.
Facebook, and then you introduce yourself.
Good morning.
Great.
Good morning to everyone. I'm Akua Oduraa Nuamah, a
Yes.
midwife and a public health nurse. Very passionate
Okay.
about cervical cancer prevention.
All right. Thank you very much. Mami is a postgrad student, and I'm happy she actually is doing that, because before she started, she put a call across to me then, and I was telling her that, hey, it's not easy, and she's saying that it is not, but she can. So I'm so happy you are doing your postgraduate. It's not everybody that can do it. And this morning we are happy to have you here. She also
Thank
works with
you.
a facility called Elimas. This is an advert I'm doing for them, and I'm hoping they are going to give me a free screening. I'm not going to pay. Yeah, so we are discussing cervical cancer. Mami is going to tell us more, and then there will be a discount if you go to them and you say that you watched Mami on Anita's page, and she said there will be a discount. They are going to treat you nicely and give you a discount for the cervical screening. Yes. So, Mami, first of all, you've introduced yourself. You are a midwife and a public health nurse. Now, we are starting because people are busy this morning and they have to go about their duties as well. What is cervical cancer?
Okay, so to begin with, we have to know what the cervix is entirely. What is the cervix,
All
or where
right.
is it located?
All right. All
So
right. Great. So
the
go on.
cervix is the neck. The cervix is the neck of the uterus, or it is the entrance that leads to
Okay.
the opening of the whole uterus, or quote unquote, a layman will say the womb. So
Okay.
the cervix, that is where this cancer we are talking about affects. And so we say cervical cancer. Now, the
Okay.
cervical cancer is a cancer that comes about with a persistent infection with the virus known as the human papilloma virus.
Okay.
I use the word persistent because this virus, when you are introduced or when it comes in contact with your cervix, it can hide between 10 to 15 years before it starts causing any change at the cervix. Yes, that's how long it can take. So mostly people get it in their mid-life stage or in the youthful stage. And because it can hide for this number of years, by the time they are advancing in age, that is where the disease is showing itself. And you can't even place your finger on it, how you came in contact with the virus at that time, because you would have gotten in contact with the virus not less than 10 to 15 years before the disease starts occurring. Yes.
Yeah.
So it is a persistent infection with the high risk type of the human papilloma virus, because there are so many types or so many strains. So the high risk type, that is type 16 and type 18, that causes about 70 to 75% of the cervical cancers we are talking about.
Great. So that is about the cervix. So that is what people generally refer to as the womb. Okay. So she's saying that you may contract the human papilloma virus sometimes even 10 to 15 years ago. You may had contracted it then. It wouldn't, you won't see any symptoms. It is until later before you would begin seeing the symptoms, and then probably it had developed maybe to stage 2 cervical cancer. You may not. That's if you don't go for screening, and if you don't know your body well. Yeah. So now the cancer, she says, the cancer that affect the cervix is what is referred to as cervical cancer, as we all know. So now, Mami, what is the mode of transmission? Can you tell us maybe a bit about that?
Okay, so before we go to the mode of transmission, I would want to throw a little bit more light on the burden of the disease, why there's a need for us to be much of. So it's the third most common cancer in the world. And mostly it is people in the sub-Saharan Africa that suffer from this condition. And in Ghana, it is the most common cancer among women. Usually our concentration is on breast because the breast is on the outside, and so cancer has gained a lot more popularity. But then where the cervix is located, usually by the time the patient reports, it will be too late. But let me say that the number of cases is on ascendancy, and it calls for us to come in with so many interventions to help a lot of women to not get infected, or because it's a preventable disease and it's a treatable disease if identified early. So yes, and then the World Health Organization is saying that even in the year 2020 there was an estimated 604,237 women who were newly diagnosed
in Ghana.
6,000,004. No, globally.
Globally. Okay, great. I get it.
Yes, in the whole world. And out of this number, we had 3,401,843 died out of cervical cancer. That's about half of, or even more than half of the number who were newly diagnosed.
Yes.
And now we're saying that more deaths are being reported from cervical cancer as compared to even childbirth. I mean, women are dying from cervical cancer more than maternal mortality. And a woman is 6 times likely to develop cervical cancer if you are living with HPV. And the last thing I would want to say is that a woman who is diagnosed is twice likely to die than one who is diagnosed with breast cancer. So if you are diagnosed with cervical cancer, your chances of dying is 2 times one who is diagnosed of breast cancer.
So your risk is twice more than that of the person, the woman who is diagnosed of breast cancer. That is quite high. I mean, when you are talking epidemiology. Yeah, I can see your epidemiology is coming out. Great. You are not an epidemiologist. Wow, I can see that. So now you deal with statistics. Great. That's a good researcher. Right. Okay, good. Let's go on. So now, as a woman, your risk of dying from cervical cancer is twice more than that of the person diagnosed with breast cancer. That's what we are just trying to say. So that shows that tells you that if you have cervical cancer, your risk of dying is high. You get it, compared to one who has a breast cancer. And because of the location, because it is hidden, you may not know. With the breast cancer, you may see some of the physical symptoms on the breast, but with the cervix, you won't see it because of its location. And as such, that is why early detection is the key. Anyway, I'm not doing the talking. Mommy is doing the talking. So, Mommy, we've done. Have you touched on the mode of transmission? We did the bedding now, so we are going to the mode of transmission now. Yeah.
So with the mode of transmission, we have sexual means and the non-sexual means. So we don't want people think that you can only get the HPV infection through sexual means, but it is not just only sexual means. Yes. So with the sexual means, we have the genital, that is the female and a male,
and the male
normal sexual intercourse that we know. Yes. And then we have the manual genital, where people use objects. But some people share these objects. And then we have the genital anal. Yes. And we have the genital anal, where people do the anal part instead of the normal, yes. And that's one too. And then we have the oral genital.
Yeah.
Now, all these means we are listing is because men also get the HPV infection, but they don't suffer from cervical cancer because they don't have cervix. So in males, they get other forms of cancer such as the penile cancer, the anal cancer, and the throat cancer, among others, which is also linked to the HPV virus. Yes. And as I mentioned earlier on, the HPV virus, we have so many strains. So we have different types. And we have the high risk, the low risk, and the other types. So the high risk is causing the cervical cancer, but the low risk is what causes the genital warts. And then we have the other type of the HPV. So in men, and usually people are tempted to say that, oh, we use condoms, we protect ourselves. The caution here is that condom, though it's a barrier method, it does not give 100% protection. You can't be guaranteed of your 100% protection. Though it serves as a barrier to some extent, it is not 100%. So we can't bank all our hopes on the condom.
On the condom.
Yes. And then we move to the non-sexual means, where it is rare, but then it occurs. And with the non-sexual means, we have the vertical means. This vertical means is a mother who has the virus passing it on to her baby in utero. We call it papillomatitis. Yes. So the infection, because it is the cervix, it can spread to the uterus, and then when the baby is in utero, the virus can affect the baby. So that vertical means is also possible. Yes. And then we have the horizontal means. And with the horizontal means, we are looking at contaminated instruments. So sometimes let's say you go to the hospital and let's say an instrument is used, say a speculum. We have speculums that we have to clean it, we have to put
sterilize,
it in other, decontaminate it, and then maybe sterilize it before we use it.
Yeah.
Yes. So sometimes, in some extreme cases, when numbers are overwhelming and other things, all these processes might not be adhered to well, and then using it, you just dip it in chlorine or in just one of the contaminants is not sterilized. Maybe you are introducing it to another person, and the virus might not be dead. So you will now introduce it to another person or an innocent victim. And then we have formines. And the formines, we have things like toilet. Yes. So the toilet seat is such that people with this condition sometimes get abnormal discharges. So when they go and sit on the toilet seat, let's say at your workplace, in a public place and all that, and when they are done, they don't clean it well. When you go and sit on it, you can also take it from that side.
I see.
And then we have, if an infected person uses the washroom, doesn't clean her hands well, the person can come and use the hands on a doorknob. You also go in and open the same door, and then you can pick this virus. Virus might be hovering on your fingers without you seeing them, because we can't see them with our naked. You go in to have something to do with your partner, you don't wash your hands well or anything, and then you introduce it to her unknown to you. So you might not be doing the genital, but then you take it from somewhere, and through handshake or other form, you will introduce it. And most of when we're growing up, we had families sharing a ball syringe. In their accounts, we call it bentua.
Bentua, yeah.
We call it bentua, and then these ball syringe, yes. You know, some families used to share it. We will share it as a group.
Yes, all
one
the children
will be used for all the children at the same time. Yes, at the same time, and you can get this virus through that means, and then you introduce it to another person unknowingly. So these are some of the other forms in which we can get the disease.
The means of transmission or the mode of transmission. So let me just go back on what she's mentioned so far. Now we have the genital to genital transmission, mode of transmission, the penis to vagina. That is it. Now we have the oral genital, your mouth to the penis or the vagina. So far, the person has the HPV virus. Now we have the the non-sexual. I'll come to all that later. Sorry, hold on a minute. Okay, sorry. Great. Then we have the, can you hear me please?
Yes, I can hear you.
Okay, great. Now we have the genital anal. So anal sex. So we have those that the penis to the anus of the woman, and then so the penis to the anal of the woman, or the male both two male sexual partners, so maybe anus to anus, you get it. So that's another one. And then she mentioned also the mother to child, which is I think is that a part of the low risk or is it high, Mami?
No, it's also part of the high risk. So an infected woman transmits it to the baby while the baby is still in the uterus. So it's part of the high risk.
Okay. It's part of the okay. All right. Now, what she said that I think I have to reiterate on is the contaminated instruments. Now, the instruments, I'm not talking of the hospital instruments now. I'm talking about when you are in the office, when you are in your home, you use the toilets. Maybe this person has cervical cancer, and then she uses the washroom, and when she sits, the virus can be there, and you go in, you don't clean the seat, and you sit on it. You could get it from there. And then on the door knobs, the toilet door knobs, the handle of the door of the toilet, when someone who has the virus opens the door to the toilet or was coming out of the toilet, when she had not washed her hands or he had not washed his hands and opens the door, and whilst you were going in, you open the door as well, you can get the virus from there. And that is why hand washing is very, very important. Aside COVID, hand washing is very, very important from what we are seeing or hearing now. And now, so those are the modes of transmission. Now we are going to the signs and the symptoms. Mommy, so please, okay, before we go to the signs and symptoms, okay, maybe we do that at the end. I wanted to say something on the non sexual aspect of it. There's the sex toys, but I think we'll come back to that. So let's go to the signs and symptoms now first. So please, the signs and symptoms of cervical cancer.
Okay. So women who have cervical cancer, mostly because you will identify it in middle-aged women, they might have reached their menopause, but then they will start bleeding again.
Yeah.
So this person is known to be in the menopausal age, and then an unknown bleeding starts to begin.
Yeah.
And then there's also the intermenstrual bleeding. So a young woman, you get your menses. We all know the normal 28-day cycle, but then there's still some variations. I think 21 or 22 upwards up to like 30 days. There's still some range. But then when you are done, we expect that on the minimum or on the average, when your menses should occur. But in between this period, this person starts to bleed again. So intermenstrually, the person keeps bleeding. And then there's also what we call the abnormal vaginal discharge. And this is where I would want to throw more light on it. Most ladies will go to the pharmacy, and then all they'll say is that, oh, I have quote unquote white. What is white? The normal secretions in a woman's vagina is
hello, mommy.
Major things occur. Then
hello,
we say
mommy.
you have infection. Hello.
Can you repeat on the white? I think you went off a bit.
Okay, so what we're saying is that there's a normal secretions in a woman's vagina, which is normal.
Okay. Yes.
And that secretions should be white in color.
Okay.
However, when three major things occur with this secretion, then we can say there's an infection. One, when the color changes.
Okay.
Two, when it becomes offensive, as in it begins to smell.
Okay.
Three, when the discharge becomes abnormal, that is, it becomes more than the normal, purulent, or and sometimes you see it like a curdled milk. Yes, and all these things are not supposed to be so. So when you see all these changes, then we say there's an infection. And we are not limiting it to only cervical cancer. Other yeast and other bacterial forms can give this infection. However, in some women, it keeps recurring all the time.
Yeah, most times.
Yes, most times. When you come with this repeated infections, what I will do is that I would want to first of all examine your cervix to see what is happening there.
Yes.
Which in most facilities we don't do it. So based on the signs and symptoms you are presenting, we'll give you medication.
You just give the
go
medication.
Exactly. At most, they will ask you to go and do high vaginal swab to see what kind of bacteria or yeast or whatever is causing that infection, and then they will treat. But if it is as a result of a pre-malignant lesion which is occurring at the cervix, you will treat it, it will go and it will come back again. So you would want to do a better screening to be sure that you are ruling out cervical cancer. Most people with cervical cancer also present with severe.
Hello, Mommy. I think you went off a bit. Let's see.
So most people with cervical cancer also present with severe abdominopelvic pain, as in the lower part of your abdomen. There's this sharp pain that occurs. And then in a normal human being, when there's a coital incident happening or during sexual intercourse, we don't expect you to bleed. Most people after the postcoital, they bleed, and it is not a good sign. So you would want to visit a facility for you to be assessed. Because of where the cervix is located, most women feel shy to go and open themselves up for them to be examined. But this is a preventable disease. It is a treatable disease. And that you wouldn't want to find yourself in that situation in the extreme stage where it could have been avoided or prevented. So basically, these are the...
Okay, go on.
These are the major parts of major component or major signs or symptoms that we expect to see. Yes.
Okay, great. Now we are going to tree. Mommy, in tree, can you tell me? Okay, or let me say it in tree rather. What you have said. Yeah. So at therefore, yeah, can cervical cancer ho asem na yeah, mommy Akua Oduraa Nuamah ye midwife and or public health nurse. And say no or train science adia ubehu potin ebema wehu se sebe uwo cervical cancer ana uyenya cervical cancer. But cervical cancer ye try say adia ye betimi asan oyare se hu ne ntem a eno ne ye frɛ no early detection. Ye hu ne ntem a ye betimi asan oyare ba ye hu ne ntem a na ekodu beye stage 3-4 dia na kyese sebio ebetimi de wako owo. Nti say no opatre say oba Ghana for mada bia mo se munya white yenim se munya white, but you can say etwe no enoa de enoa mensu a ye friend no say discharge ye friend discharge, but discharge no ensese ebon ana ensese ewon kan bia enoa wo enoa nenka a emma nyina nim, even emma kra nim obema bia waware no obehu enti no enoa wo onoa ne sense enti ne wote se ebia etwenim bon somewhere bia nyesa na tie first se ukọ hospital enna wohu se one obema eda anase uni ukun hia wase ya oya, because bia cervix de wono ewo umu ewo inside ba obetimi afeli oya no ana pains no enti no uhu bibisa esa ukọ hospital mama aniwo enkun enhye dem, because who the you can say aniwo, right? If okase ofere efere efere Ukasa oferia dachi bi no ebeya o na bedru stage bi kra no chese wa na nkrofo nyina obi abehu at the end of the day nkrofo behu enti aden na start no unko hospital ntem so what you say sa na watimi yetimi asan yare ntem na eye bibidro no mepamocho bibidro na mode hyemase no cure cervical cancer enti no se muhu sa because a virus fine ubetimi aye preventive means but san cervical cancer no enti no muma yehu we enti sese no ye san kono brofo enti sese no uhu bibi discharge bia enye se de na esitie na se uko hospital na ma doctor hu white no nso eba to aso ade friend recurrent infection na chese bibi wo ho a cause so ade no enya white nkoa ye wo de friend yeast infection no de ye normal oba bia betimi enya bi but eba to aso a na chese bibi foforo eka ho what I say. Okay, me that say inti yenkoso mami. So let's go on. So now we are done with the signs and symptoms. Now we are going to the risk factors, right?
Yes.
Are you okay? Okay, great. So can you tell us some of the risk factors?
Okay, so with the risk factors, we are looking at young women or young children who have sex at an early stage or at an early age.
Okay.
You can start because you can say, and let's say a young lady of about 14 years or 10 years, 13, 12. If the person becomes sexually active at that age, the cervix is not well matured. Cervix means when you are infected, the virus will destroy the cervix at a faster rate because the cervix is not well matured.
Wow.
So our young ladies who are pushed into early marriages and other forms of marriages and other forms of sexual relations at that early age, what we're saying is that the cervix is not well matured, and so the virus will cause the destruction faster than an elderly person. And then we're also looking at people who smoke. There are some women who smoke. There is an object
smoking.
in the cigarette is smoking. Yes, that is called nicotine.
Yeah.
When this nicotine is introduced into your system, it makes you more prone. And then when you are exposed to the virus, your rate of progression becomes more faster.
Okay. Okay.
The next one we are talking about is multiparity.
Yeah.
And as a midwife, when we say multiparity, we are talking about women who deliver plenty.
Okay.
In the urban setting, we have just a few women delivering plenty because they are coming down a bit.
Yeah.
But when a woman delivers plenty, because at each delivery during contractions, we expect the cervix to dilate or to open up for the baby to be able to come to the cervix to be delivered. Now, when this keeps occurring for some time, the cervix becomes weak because dilatation elastic. Stretch it, now come back, stretch it, now come back, stretch it. Now, the baby, it will be so weak that the least infection, it will destroy it faster because the strength of the cervix would have reduced. And then we're also looking at multiple sexual partners. So I may have one partner, but my partner may have a partner.
Yes.
Which I might not be aware of. And we have a lot of people doing, and we have a lot of people even doing the threesome, exploring so many fetish kind of sexual means, and then all these things. Yes. And then we also have the immunocompromised. Immunocompromised, yes. We're looking at when we talk of immunocompromised, most of the time our attention is linked to people with HIV, but no. If you have had an organ transplant, your immunity has been compromised. If you have been on any treatment that involves a chemotherapy, radiation, or high radiations or other forms of injections being pushed into your system, your immunity has been compromised.
Yeah.
So immunity here, we are not talking about just those with HIV. Mostly when we talk, that's why I want to make the clarity that, okay, so we have people going in for kidney transplant, liver transplant, other organs of their bodies being repaired. Once that surgery is done, your immunity is compromised. And so your risk becomes higher.
Oh, okay.
Yes. And then we now talk about the sexually transmitted infections, mostly the HIV people.
Okay.
You know, once you have the virus living with you, naturally it is targeting your immunity. And so it makes you more prone to, when this virus, the HPV is also introduced, you become at risk higher than a non-HIV infected person. Now, I would want to pause here a little bit and say that with sexually transmitted infection, with the little practice I have done as a midwife,
okay,
now all our attention or all our focus is on HIV. But trust me, a woman who has syphilis, you wouldn't want to see the baby they bring, because that's what we call a syphilitic baby. It is not a good sight to behold. Syphilis can hide in a woman for a longer time before.
Exactly. And it seems the awareness for syphilis is going down.
Yes.
It seems.
So I mean, I did surveillance system evaluation on STI, and then with the little I got to know, even the reporting system has issues. So it is only in pregnant women that we are screening VDRL and then want to know their syphilis, because we want to prevent it from the baby getting it whilst in utero and all that. But then it's not just about pregnant women. Every woman at a certain age should be screened for all that. It should be a routine thing, because a lot of innocent people are walking about with syphilis unknown to them. And it is just a disaster waiting to happen one day. So syphilis is one of the diseases I'm very much particular about, because HIV, all these things are, and even with syphilis, it can be treated and all that. So why should you wait to suffer from that disease, which can be cured? And the last thing I would want to talk about is not the last thing, but there are lots, but these are the major ones I've listed. The last thing I want to talk about is poverty. Poverty is, let me say, number one risk factor.
It's the number one risk factor in most of the diseases in Africa. I mean, let me say sub-Saharan Africa. Yes.
Yes, poverty is one, because the types of screening methods that we do, we have a type that is as low as 5 Ghana cedis, but not everyone can even afford.
Yeah, you're right.
And the poverty, and then the other thing too has to do with illiteracy.
Okay.
Gone are the days where most women didn't know that they should own their reproductive life, to be able to take decisions on their own, to be able to do things that will benefit them and not anyone. So a woman would want to go and seek permission from her partner before she comes for screening. Forgetting that when you die from the disease, your partner can get another woman.
Of course.
So you would have to own your reproductive health as a woman. And so with people, and I pause here to say that some cultures or some religion, it is very difficult attending to their women without their spouse's approval. When it has to do with invading in their private part.
Yes, you have to ask them. Oh, we are going to do this to your wife. Yeah, I've worked in a hospital where we had such issues. Yes. Yeah.
And so it impedes the things we want to do, because at that time you want to do this to help this woman, and then if she goes to seek permission and she's not granted, what happens? You miss out on this patient.
Exactly.
But the signs and symptoms the woman may be presenting may be mimicking what we are talking about.
So okay, go on, finish that.
So those are the list, the predominant list under the risk factors that I can say now.
Factors.
Yes, which is peculiar to our setting.
So poverty is number one, and just like I said, poverty is the number one drive for most of the diseases we know in sub-Saharan Africa, not just in Ghana. Religion sometimes plays a part. Plays a part. It plays a serious part, because when someone is diagnosed, she wants to see the pastor first before taking the medication. My pastor says I will be healed. They prefer the anointing oils to what the doctor is giving. So religion is another issue. Then she mentioned multiple sexual partners. For this, I have to emphasize on it. You see, I, for one, I'm actually very scared of relationships because of that multiple sexual partner thing. Because you feel you are dating A and you trust A, but A is dating some other persons, and the person A is dating some other man somewhere. So I'm very, very, when it comes to relationship, I'm scared. But we have to do what we have to do. That's the reality. So do you know your partner that much? Do you trust your partner that much? You get it? That's if you're not married. Most married folks are faithful, but a lot too are not faithful. And then you may think that the condom, maybe you wear condom, so you are protected. No. Sometimes with the HPV, with the virus, anything that has to do with virus, you are not protected because of the nature of the virus. And there's no amount of antibiotics you self-medicate on that would cure it. You should know this, except you've gone to the hospital, you've been tested, and then the doctor gives you a medication. The herbal concoctions as well do not help to clear cervical cancer. We should get this. The anointing waters will not clear your cervical cancer. Prayers will not cure your cervical cancer. So as you are doing your prayers along and drinking the anointing water and oil, make sure you are going to the hospital and screening and taking your medications. Yes. Now we are wrapping up. So we are coming to the types of screening, and then we end up or round off with the prevention. And then, like I mentioned to you, there is a discount when she will mention the phone numbers and then tell you the location. Mention my name. I said mention my name when you go there. There will be a discount, even if it is your transport. They are going to give you a discount. They don't have an option, okay? So ladies, I want you to go for the cervical cancer screening on me at a discount, please. And this is not just the normal pap smear, this is an advanced type of screening whereby, in short, she will tell you more about it. Don't let me say it. So let's go to the types of screening, Mame.
Okay, so this is let me say my favorite part.
Okay.
as we said, that people do not come to the facility to get screened because so let me say Ghana Health Service has a standard protocol. And per the protocol of the Ghana Health Service, what they say is that we have to screen every young woman at the age of 25 to 45 with VIA. VIA is an acronym that stands for Visual Inspection with Acetic Acid. Now they are saying that we should screen every woman above 45 years with pap smear. And the pap smear is where we get to, okay, so let me show, this is a disposable speculum.
Okay, yeah.
So when you come, we get to open it. This is a disposable speculum. So when we open it, we insert it in the vaginal area, and then we open it up. When you open it up like this, you will lock it. And then when it locks, it makes the cervix visible for us to see. So we're able to visualize your cervix through this instrument. Then we will go in with the pap kit. So with the pap kit, we have the spatula and we have the brush.
Yeah.
So this is how the spatula looks like. You see, it has two different shapes at the edges.
At the edges, okay.
Yes, it has two different shapes. But there's what we call endocervix and an ectocervix. So the endocervix is the one that is inside, and then the ectocervix is on the outside. And this is called the brush. It has a brush at the tip. So we will insert this brush into the cervix, that is the endocervix, and then we'll scrape cells at the cervix, and then it comes with a slide. So there's a slide here that we will smear it on it. And then we'll go in with the spatula. So with the spatula, we're going to take both this side at the ectocervix, smear it also on the slide, and then we use this side as well to also scrape cells at the
outside and then put on the slide.
Yes, and then we'll put something on it, a reagent on it that will prevent it from being dry so that the cells can be protected. And then we'll take it to the lab. Now, when we take it to the lab, what they are going to do, we call it cytology, studying of the cell. So the cells at the cervix, they're going to study it under a machine to know if there is any changes that is occurring at the cervix. Mind you, I said that we can come in contact with this virus and it can persist between 10 to 15 years before the disease comes about. So if within all this time there is no changes at the cervix, the pap will not pick it. It doesn't rule out the fact that the virus may not be there. Thank God we have Hpv Dna testing. And the good part about this testing is that you don't need to lie down for me to insert the speculum and go and use the brush and all that. The good thing is that you get to take the sample your own self. And it is so easy to do. I mean, in the comfort of your home, your office, or even when you come to the facility, you don't need to book. You can just walk in and come and take your sample, and you've screened. So when you swab the cells at the end, this is what we use for the Hpv Dna testing. It's just the normal HBS. There are two types of brushes that we use. So this one, it has a cotton tip. And then there's what we call the Evalin brush. But the Evalin brush is still too big and it scares people. So we don't really do much with the Evalin brush. We just do with a small one. Whereby when you find yourself, or when this swab stick is given to you, you go to the washroom, make sure you wash your hands very well, and then you put one of your foot on top of the potty. Then you will unscrew it. So when you unscrew, you pull out like this, then you insert this one deep. When you insert it, because you are standing, the cervix drops into the vagina. So as you turn this thing in about 10 times, it is able to scrape cells at the cervix. Mind you, it is a DNA kind of testing. So a little cell that is even scraped, we are able to identify whether you have the virus or not. And the good thing is that the virus has to, we can detect the virus even before they cause the disease with this kind of testing.
Okay.
So with this test, we get to see, have you been exposed in the first place? And if you have been exposed, what strain or what type of the virus have you been exposed? And I said we have the type 16, type 18, which is the high risk. So this is the high risk also one. Identify the, yes, it is also able to identify the type of the virus, because someone can get only type 16 and not type 18. And someone can have both type 16 and 18. And someone can have only 18 and not 16. Someone can have the low risk type, which is the type 6 and 11, that causes genital warts. And the genital warts, most people don't know it is an infection. So as a woman, your vaginal area, the outward should be clean. But some people have this small growth, and they call it in tree, cocoa, and those things. And so they don't see it. It looks like cauliflower.
I was going to mention on that. Go on, yes.
It looks like cauliflower, which shouldn't be there. It is a virus that has caused that genital wart, which needs to be treated because it can be treated. So you pick, and it's on the outward. It is not on the inside. So imagine that you think you are using a condom to build protection, which is just going to protect certain portions of the genital area, and the other part of the woman is not covered. So you can pick that low risk type and transmit it to another innocent person. And then the last one is colposcopy. The colposcopy is a machine. It's like a microscope. So we have the stationary, we have the mobile colposcopy, where we get to use it to visualize. And at this stage, it magnifies your cervix. It makes the cervix become a bigger one, so that if there is any lesion or anything going on, we're able to see it well and take a sample for examination.
Okay, great. So now go on. Continue, please.
I am here to place more emphasis on the Hpv Dna testing. And as you rightly mentioned, January is Cervical Cancer Awareness Month. Elimas Health is offering Hpv Dna testing at a discount. Now we are charging 180 cedis. Just walk in, mention Anita's name as a reference, and you pay only 180 to get this screening done. So this one, if we are able to identify that, oh, you have been exposed to the virus, but the disease hasn't occurred, how do we stop the virus from causing the disease in the first place?
Okay.
Because we have seen that the virus is there. How do we prevent it from occurring? That is what we are doing now, because we want to prevent you from getting the disease in the first place.
Okay.
Mostly when you get the disease, and because we always find them in the advanced, after even painful and expensive treatment, few women are able to live more than 5 years of their birthdays. Like to celebrate more 5 years. You are limited in time of survival because usually we identify it in the late stage. So HPV DNA testing, on the average, we take 300, but we've slashed it. We want every woman to screen. So the 180 is just paying for the test, no profit, because we want every woman to screen. And it is just for the month of January. Please. After 31st January, we will revert back to our old price. This is a good deal for every woman to screen. And I'm going to leave a contact that afterwards, if you are a group of 10, a group of 5, you can be sisters, you can be in a group, a WhatsApp group, you can be in an association in church. You can, if you want us to come there and take your samples, we will come. Let's say you are in your office and then you have about 5 or 10 women in.
Okay, great. We are back. It's you went off a bit, maybe my network. So now you are going to start from, you said it is 300 cedis, right? And then you are slashing it to 180.
Yes, but we slashed it.
Yes,
180
great.
just for the month of January.
Okay. Okay.
Only for the month of January. We want every woman to screen as possible so that we can build a healthy nation.
All right.
And the good thing is that when you do a pap smear, and it comes out negative, that's what we're saying, that you can take your vaccine, all right, but then you wouldn't know whether the virus is there, but because they haven't caused any change.
Okay. Someone says we should come again. Please come again.
I should come again on which part, please?
Yeah, so I think let's start from, okay, you start from the where you said the pap smear and the what?
So the pap smear, when you do it and it is negative, it doesn't rule out the fact that you might have been exposed to the virus. It's just that the virus is buying time to cause their destruction.
Okay.
But the HPV, if you are exposed and it hasn't caused any destruction, will still be able to detect the virus. And then once we're able to detect, we are able to come up with a protocol that will prevent you from developing the disease in the first place.
Okay. So, well,
when you do a pap smear, when you do a pap smear, you have to screen every 3 years. But if you screen for HPV, you have to screen every 5 years.
Okay.
And if HPV comes out negative, then there's a vaccine you can take which will build a lifetime immunity.
Is the vaccine available?
Yes, it is.
At early mass?
Yes. It's not just early mass. I think Rach Hospital has the vaccine.
I know of Kolebu only. I don't know of any other place.
Rach also has the vaccine.
Okay. So now, Samuel, thanks for joining in. Kwabna Terence, Elom, a whole lot of people joined in. And if you don't comment, I wouldn't be able to see you joined in because of the streaming app I'm using. So thanks a lot, Samuel. And Samuel says, my boss is here. Let me show what Samuel wrote on the screen. It says, my boss is here. I can't be anywhere than to be here. I see. Hey, mommy, you have some macho boys surrounding you, Charlie. Okay, he says you are doing a great job. Kofi Ahabli says hello. Kwabna Terence is giving two. I will say you too. And then Elom as well. I'll say you too. So okay, now someone says let's go back to the direction and contact. Inti my direction nibium for cervical cancer screening no me paucho.
Okay, I spoke about the Hpv DNA testing, and then the pap smear, and then the VIA and colposcopy. These are the types that we do. So what I said is that Hpv DNA testing, it detects the virus that causes the disease before the disease starts. And a self-sampling method where you get to take the sample yourself. You don't need to lie down for us to insert a speculum. So in the comfort of your home or your office, you can screen. And you can also walk into the facility and screen. So we use this swab kit, whereby you use it to sweep cells at the cervix, and then we take it to the lab. So when we give you the swab kit, we'll show you, we'll demonstrate it to you how you're going to do it. You go to the washroom on your own, and then you take the sample, and then we get to take it to the lab and run the test for you to have your results. The pap smear, you will need to go to the hospital because it has to be done by a trained professional, where we get to insert the speculum. This one, you may not see this in some public facilities. What they have is a metal one, which is reusable.
Yes.
So when we insert, we will disinfect it and reuse it.
Yes.
We have chosen the disposable,
to do the disposable one.
Infection.
So you see, Elimas is using the disposable one. So the speculum no you unkwa na obe yusu. You see, unkwa na obe yusu. U yusu ape na chese oma to atwene. U yusu nso na so pese de wade kofie de a. And the wa wasem. Yeah, the bema. And no, you can see that 180 cedis no. Yeah, juma pa. We unkwa na obe yusu. Enye se ye metal one na obi yusu a na ya paper one no ho na ye be sterilize and sana we yusu no we no unkwa only you uses it. It is disposable. So it is for you alone. That is the advantage. So let's go on, please. So who says and Patricia Richardson? Okay, go on, please.
So the VIA is a visual inspection with acetic acid. That one too, we have to insert the speculum and visualize the cervix, and then we come in with something like this. So this is just a cotton tape.
Yeah,
it's just a cotton tape that we will insert it. We will dip it in a vinegar, the acetic acid. Then we will use this thing to dab at the cervix. We use it to clean the cervix. When there's something occurring at the cervix, the normal color of the cervix is pink. But then when we put this acetic acid there, and there's a pre-malignant lesion or there's a change, the color of the cervix will change to white. So at this stage, it means whatever is happening should be visible to the eye. Meaning it would have advanced before the BIA can take it. Because all the others are studied in the lab. But this one, when we dab it, you have to see it with your naked eye, meaning the change would have advanced.
Yes.
Yeah. And so when we see it like that, and in some cases we can apply what we call Lugos iodine. And with the Lugos iodine, the area which is not infected will be darkened, but the area which is infected is going to be yellowish in color. So these are the three, and this, at least what we are saying is that even women in the rural areas, when we are organizing medical outreaches for them, at least let them benefit at least on the minimum with the VI. So we need a disposable speculum, we need our cotton tapes, and then we need our acetic acid, we need glass, and we can screen a lot of women in the rural, those who cannot afford. So most medical outreaches that we do, we just go and do malaria screening, we do, and then we treat people of hypertension and other things. But at least, can we add at least VIA to it, so that even if something is occurring, we can pick it early. because there are some procedures that people get it, just a small portion of the cervix is affected, and that's what we call leaf. A surgical procedure that we used to take just a small portion of. You take a sample to the lab, it comes out negative, and then the patient can take a vaccine and build immunity, meaning the patient is cured.
Yeah.
So at least, can we do this one for them? At least it is cheaper. And that's why I said as low as 5 cedi, you can buy all these items and see.
All right. So
but that is when the disease is visible to the eye.
I see.
Yes. And then the colposcopy, it is when we do the CIA. With the colposcopy, when we do the CIA, and then we realize there's some changes, we will now use the colposcope to enlarge the cervix to see from where to where has it occurred, so that if we are taking a measurement, if we are describing it for the doctors to know what is happening, then we're able to give accurate description for the management. So with the colposcopy, we're able to take images. So we're able to take images with the colposcopy. And then that one, when we take the image, you, the woman, you get to see your cervix. So you get to see that, no, this is what is happening there. We show the images to you, and then you become a part of the delivery, the treatment process. Yes.
I see. So Patricia Richardson says, that's my boss right there. As usual, keep as usual, rightly dividing the facts and the truth. Keep moving, keep going, mommy. Okay, that is that. And then Kwabna Esiama Jr. says, hello, if I heard right, you said after testing negative to the HPV, a vaccine can be taken to build a lifetime immunity. How much does the vaccine cost?
I am very careful putting out amounts because there are so many facilities that have them.
Vaccine, yes, and the prices may differ.
I'll put the number out, and then he can call on the number, because you can quote a price today. It will be different from how Rich or Kolebu or other places charges it. And there are so many factors that goes into costing of medication. When it is a government or a public facility, they have support from government with regards to paying of electricity bills and other consumables. Unlike a private facility, that when the light goes off, they will have to even buy fuel to power their generator to keep the vaccines in its cold chain required temperature.
What do we use?
You will need to buy prepaid, you need to buy fuel when the light goes off, because the vaccines are kept in a certain temperature that is within the cold chain. So this private person, the price will not be as the public. So I'm very careful. And even among the private facilities, each of them and how they cost it. So when I'm done and I put the number out, I will, when they contact me, let them know how much it costs at our facility.
Yes. So she's going to put the number. Okay, so now in the comment section, you're going to write out, we are going to type out the number. I'll type the number and she's going to mention the number now. So please use your phone and type the number in the comment section on my page, and then I'll show it on the screen here. So that I'll show it on the screen.
So the number is 055.
Okay, let me.
23.
05523.
05.
05523, right? Yes.
Yes. 888
88
260
260. Now let's call it
Yes.
again. 055 23 88 260. Am I right?
Yes, you are.
All right, great. So I'm going to show it on the screen now. Now that is the number to call, listeners. So please follow. I see the number on the screen now. That is the number you are going to call for the screening, cervical cancer screening, and then they have the vaccine as well. Now remember that I said when you go, you mention Anita, and then they are going to give you a discount. It is actually 300 cedis or more, but they are giving, and this is an advanced type of screening. That is what you should know. It is not the normal pap smear. So look at the number 055 23 88 260. So you mention Anita's page, and then you get that discount. Please, 180
shouldn't
cedis.
worry.
You see, she said, don't worry at all. Please and please, let's go for this screening, ladies, boyfriends, men that are watching me on my page. I know a lot of you are listening. Please and please, if you can, pay for your cousins, your sisters, your nieces. Just do it for them for this month of January at a lower cost. At other times of the year, other months of the year, it's going back to the normal 300 cedis plus. You get it? So please, this month, let's do this together, and then a lot of women may be able to avert having the last stage of cervical cancer. So please and please, that is the number. Now we are going to the last thing, which is the part that is very important. The number I told you I'll put out, which I've done, and now we are going to the prevention. So prevention, and then we are done. Yeah, thank you. We are running out of time.
Okay, so preventing, we have two types of prevention. That is the primary prevention. And with the primary prevention, it has to do with lifestyle modification. And the lifestyle modification, if you remember at earlier part of the presentation, I spoke about the risk factors. All these risk factors that we listed, how are we going to modify it now to prevent us from getting HPV infection? So it means in younger women, we have to delay onset of sex because the cervix might not be mature. So when we delay it, we save ourselves. We have to avoid smoking because we don't want the nicotine in you. And then we also have to avoid multiple sexual partners. And the last part I want to say is that in the HIV or the immunocompromised people, please adhere to the intake of your medication. Because as you are taking the medication, you are helping your immunity to be strong. And then once the immunity is strong, then you prevent yourself from getting the cervical cancer.
Exactly. Multiple partners. Ladies, please and please make sure, well, it's up to you, but then multiple partners don't help, even men. Because as a man, when you have the HPV, when you get the virus, it's going to manifest in another form. There is penile cancer. You get it? Because you don't have a cervix, it is going to be penile cancer. Cancer of the throat. So please and please be careful. So now we've done all we have to do. And now I'm going to mention a last thing. Sharing of sex toys. Stop sharing your sex toys. If you can't afford one, stay on your own. or you get a boyfriend. Yes, because these little things you take for granted are the ones that put you at risk health-wise. You get it? So don't share sex toys. And if possible, if you know you don't trust your boyfriend, I beg you, stay alone. Marriage and relationships are not by force. Having a healthy life is better than being with a man or a woman whereby you are going to contract a disease and you are going to die. The man, when you die, the man's girlfriend will be at your funeral. The girl no be what you na say. In short, your 1 week celebration no be what say. What I say. And as a man, maybe your wife no she was cheating her. Maybe at your 1 week ceremony, her boyfriend will be there. You get it. So please, let's be careful. Make better choices and then let's live healthy. Avoid too much salt and sugar this year. Tomorrow I'll be here with a consultant dermatologist, a West African fellow of the College of Surgeons. This year I'm not going easy cry. I have how should I put it? Quality resource persons, and I'm so happy that they give me audience when I go to them. Some of them are my mates, some of them are not. But when I just call them, they are ready and they are so busy. I mean, it's what I really appreciate. Tomorrow, the consultant dermatologist, Dr. Omotoyo Sibamidele Ilesomi, is from Nigeria. She would be joining us and I'll be talking about bleaching and toning. I know a lot of you may not like this topic, but it is important we listen to it because she's going to give us the pros and the cons of bleaching and toning our skin as brown people. I call myself a brown person. I'm not a black person. I'm brown. So please, tomorrow, stay tuned. I'll put the poster out there. And thanks all for watching and joining in. I appreciate your time and whatever. I mean, you left whatever you are doing to join in and listen. Thank you very much. That is the number on the screen. Call Elimas.
So please, mention about a quick one about the primary prevention. About the primary prevention, we also have the vaccination or the immunization. And with the vaccination, we have the prophylaxis. And when we say prophylaxis, it means we are giving it to you before you become exposed. So if you have immunity and you are exposed, it means you are protected. And then we have the therapeutic, whereby people have gotten the disease, but then we are able to treat them, and then we give them the vaccine afterwards to build immunity against future exposure. And the types of vaccines that we have two types of vaccines. We have the Cervical and then the Gardasil. The Cervical is against type 16 and 18 alone. So the Cervical is against type 16 and 18 alone. And then
Mommy, I think I lost you here. I didn't lose you. I didn't lose you. Your network is bad, I think. So you are going to have to repeat that side, what you said. Hello, Mommy, can you hear me? Hello, Mommy, can you hear me? Okay, so Mommy is fluctuating. Her network is fluctuating. So she was talking about the types of vaccines, but I think we've ended. So the number on the screen, go for your screening at 180 status. Okay, you're back. Great. All right. Okay. So round up and then we go.
Exactly. So what we give mostly is the severus, because we want to build immunity against the high risk type, because that causes about 70 to 75% of the cervical cancer. Now we are saying that children at age 9 to 14 years who have not been exposed in any form sexually can be given the vaccine without screening.
Yeah.
So those children can be immunized, and in that vaccine, it can be given to both males and females. That is the Gardasil, to build that protection. So at that young age, between the ages of 9 and 14, we can give them the Gardasil vaccine as prophylaxis. And then the secondary prevention is the screening that we are talking about, because you screen to prevent the disease, and you screen to detect the early form of the disease for treatment. So that is all about the prevention, where primary focus is on the lifestyle modification and vaccination, and the secondary focus is on the screening. Yes.
All right, great. So
that's it about
I'm retracing on this. Any girl child that is 9 years and above can be given the vaccination, and that prevents all. Sorry,
years.
9 to 14 years. Who is not sexually active already? If your child is sexually active, please, she is not part of it. So if you have a child 9 to 14 years who is not active sexually, I'm not using the word virgin here because I know why I'm saying that. Okay, so you have to take the child for vaccination, and this would reduce the risk of the child contracting cervical cancer, right, Mommy? Am I right? All right.
Yes,
thank you very much. So I've put it on in this comment section. Immunize your girl child at 9 years. Let me write it: 9 to 14 years. Who is not sexually active. So we are wrapping off here and ending it here. That is the number on the screen again: 055-2388-260. Discounts at 180 cedis instead of 300 cedis plus. Go for your cervical cancer screening, and let's all be good and healthy. Thank you everyone for joining. Natasha, everyone, Kwabna, Kwejo, Ama, Patricia, Akosia, Anita, oh my namesake, Samuel, Elom, everybody. Thank you very much. We are done for cervical cancer. Tomorrow I come your way again with bleaching and toning. Bye.
Bye. Thank you so much for having me.
Thank you.